You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, don't let your fear of the dentist or your busy schedule keep you from having the smile you've always wanted. We're talking about sedation dentistry. And with us, we have San Antonio sedation dentist. With us, we have Dr. Dan Holtzclaw. Dr. Holtzclaw, welcome to the program.
Thank you, Randy.
Now, I know you brought a lot of photos, so we'll try to get to as many of those as possible. Now, for people that don't know your practice, and you have a few practices, who's the typical patient? What are the different services that you offer?
Yeah, our typical patient is everybody.
Okay.
We don't have one particular type of patient. We have patients from people needing one small minor procedure to a full mouth worth of procedures. We have patients from the high school janitor all the way to the company CEO and celebrities that come in from out of town. Literally every walk of life.
Now, sedation dentistry, which is today's topic, two categories, the phobics and then the people that are just busy. And you say they could get like 1 year worth of dentistry in one visit, which I'm not sure what that means. So who is the typical sedation patient? And is phobia really a big deal out there? Like common, I should ask.
Oh, very, very common. I mean, there are many, many patients that will not even step foot into a dental office. And
really?
We see this as a very common refrain from a lot of patients that we see, that typically something happened in their past, either when they were a kid or early on when they were an adult having treatment done, and something happened. Either it was painful, they didn't like the dentist, and they associate this with bad things. Pain, they don't like the sound of the drill, they don't like somebody with a white coat walking in. You know, it scares them, and they avoid the dentist for decades.
Is that right? You've had people that haven't been to the dentist in 20 years?
20, 30 years, and typically things get to a point where either A, they're having so much pain, they can't put it off any longer. B, there's some type of life event, usually retirement, grandchildren having a recital, some family reunion, class reunion. Matter of fact, patient that we saw last week, she was having a 20th year reunion. She wanted to look better. So she came in on Monday afternoon. So within 24 hours on Tuesday, we did a variety of procedures for her under IV sedation. She was asleep for everything. And when she woke up, everything was finished. And she had put off going to the dentist for years. And now
hers was a fear, like a phobia.
Hers was a fear. She didn't like the sound of the drill. She did not like the dentist, period. When we did her consultation, she wouldn't even sit in the dental chair.
Is that right?
She sat in a regular chair in the corner of the room that's typically for a family member. And so we did the consult for her right there in the chair. We had the CAT scan to evaluate everything. And the CAT scans are nice because we can see the patient from the inside out. And we can see everything. We can see how thick the bone is, the position of the nerves, cavities, bone loss, everything. I don't even have to look in your mouth because there's nothing you can hide. I see it direct from the CAT scan. And so for that type of patient, the worst part of the day is just getting the IV. We give you the IV, we put you to sleep, and you wake up and everything's finished.
Now with these people, some people are so phobic, I think you told me this, that sometimes you have to prescribe a pill the night before just so they could sleep.
Yes, that's very common.
Is that right?
Yes, and that's very, very common. If they're avoiding the dentist for many, many years, the thought of going in, even though they know they're going to be sedated, is still a scary thought because they haven't been to the dentist in, forever. Most of our patients, actually, we do prescribe a pill the night before to help them relax, and it's very helpful because we do want the patients to have a good night's sleep. But it is very common for someone to come in and say, yeah, I couldn't sleep last night because I was just dreading this procedure. And we tell them, we're going to take good care of you. We're going to make everything nice and safe for you. And we start the IV. And once we start the IV, the nice thing with IV sedation is everything is very fast.
And how safe is it? I'm sorry to interrupt. Okay, so it's very fast.
So IV sedation is extremely safe. Matter of fact, I published one of the largest studies ever published in all of dentistry on IV sedation used for periodontal surgery in the Journal of Periodontology. And the nice thing with IV sedation is you have direct access to the bloodstream. So any medication that you give is going to interact with the body instantly. And so we can give medications to lower blood pressure, raise
right?
blood
Okay.
pressure, increase the heart rate, decrease the heart rate. We can increase blood sugar. We can make all of these changes. We can monitor things a lot better. And you just simply can't do that with other types of sedation, such as pill sedation. If you're taking a pill sedation, you have to wait for that pill to go through the digestive system, digest, reach the bloodstream. You don't have that instantaneous effect that IV sedation gives you. You don't have the safety level that IV sedation gives you, because if something goes wrong, I have to give you another pill. And if you're already somewhat sleepy because you're sedated because of the first pill you had, I can't give you a pill and tell you to swallow this other pill. And then I have to wait for that pill to digest for it to take effect. No, with IV sedation, everything is instantaneous.
So you're looking at like what? Their blood pressure, oxygen levels?
So we use the same monitors that's used in hospital ORs.
Okay.
Same exact monitors where you're monitoring blood pressure. We're monitoring something that's much more accurate than blood pressure called mean arterial pressure. We are monitoring oxygen levels. We're monitoring carbon dioxide levels. We're monitoring your breathing rates. We actually use a special device where we can listen to you breathe on a Bluetooth headset, so we can hear you breathing. So
Is that right?
So even before, if you stop breathing for any reason, even for a few seconds, I will pick that up on my earpiece before it even shows up on the oxygen level on the monitor.
Wow. So breathing irregularities, you could hear like some
Yes.
sort of a...
Yes, and so we have all of these monitors that we're using to keep track of all the different body systems while we're administering IV sedation. And we use other equipment that is involved in the hospital OR. For example, we use a thing called a bear hugger, which is essentially a special air warming blanket. Now, people think if you put when you get an IV, you have fluid running through your body, it makes you cold.
Okay.
And so if you put a blanket on, the blanket is not going to warm you up that much. And so you have these special air heated blankets that literally heat you up from the inside. And so you typically only see these in hospital ORs, and we'll use these for a lot of the procedures. It warms the patient up quickly, makes the patient much more comfortable even though they're sedated. We can see these things on the monitors. We can see if you're too cold.
Really?
We can see if you have to go to the bathroom. I can see your blood pressure going up. I can see your heart rate increasing. And it's only going to happen for a few things. Either you're in pain, you have to go to the bathroom, or a few other medical issues. But typically, it's you have to go to the bathroom. So I can tell if you have to, all that from the monitor.
Somebody said that they looked at a study that said that statistically, getting IV sedation is safer than doing nothing at all.
Safer than driving your car. I mean, you're more likely to have a car accident coming to the sedation procedure than to have an issue under IV sedation. Now, with that being said, things can happen under IV sedation, but it's extremely important for the patient to be very truthful with the doctor.
Okay.
And a lot of times patients are having a dental procedure done and they think, well, I don't need to tell the doctor everything because this is a dental procedure. No, this is still a medical procedure, and we need to know all the conditions, your medical history. Are you taking any pills? Are any medications that you're taking? I can't tell you how many patients that we found out that maybe they're taking some home medications they really shouldn't be taking, but we can tell that once we start sedating the patients just because of the way that they react. And
Now you'll work with their doctor if necessary?
yes.
Because look, I know you have an older population because you do a lot of implant dentistry, but these people are on 4 or 5 medications.
Oh, very common.
You can work with that.
Yes. So for those type of patients, we always do medical clearance consultations with the physician.
Okay.
And many times multiple physicians, because we have many patients that are seeing a cardiologist, seeing an oncologist for cancer treatment, seeing an internist. So we'll consult with all those different physicians, let them know, one, what the sedation is going to entail, what the procedure the patient is going to entail, and if there's any modifications. And I can tell you that there's very few scenarios where the physician will deny the sedation procedure. And we even have the ability in our office to do general anesthesia. We have dental anesthesiologists that come in who are recognized specialty in dentistry now that can really completely put you out just like in an operating room.
That's rare, though.
That's very
Have to
rare.
do that.
That's typically only for more extreme cases.
Now, you have offices in Austin, San Antonio, a few offices spread out. Are you known for sedation? Is that one of the things you're known for? You've been doing it a long time?
We've done tens of thousands of sedation procedures. All of the doctors in our office that do these invasive procedures, we have all done thousands of sedations.
Do you ever have patients that were dental phobics and now they're not dental phobics?
Oh, certainly, all the time. I can think of one patient in particular. When she came in, I walked into the room and she literally shuddered just from me coming into the room. She wouldn't sit in the dental chair, wouldn't even go close to the dental chair. She was sitting in one of the chairs in the corner of the room, and we've done a significant amount of work on her. It was all done under IV sedation. And now she has no problem. She comes in for cleaning, other type of dental work done, and she knows that it's not a place to fear because, one, she knows us. She knows that we are nice people. We're not monsters, and we're not scary, and that we can do a significant amount of work and do it in a manner that is making her comfortable and alleviating her fear and anxiety.
Now, is it true? I mean, some people even get on a plane to go to your office for this?
Oh, we have.
Like I mean, literally they're traveling, flying over a bunch of other dentists to see you.
The farthest patient we've had travel is from Moscow, Russia.
Okay.
We have patients from LA, Florida, Tennessee, New York, North Carolina, and that's all within the past few months.
Because of the nature of your center where you do everything right there. Is that right?
Yes.
At affordable prices.
Because they know that everything can be done under one roof. They know that they can be asleep for their procedure. They know that we've done thousands and thousands of these procedures. They know that we can take care of the problem that they have. And they've read our reviews, they've researched our background, and they know that more than likely they're going to get this type of treatment done once. And if they're going to have it done once, they want to get it done at a place that they know has a history and experience of doing it correctly and is going to meet their needs and their desires.
Okay. Now, moving away from the dental phobics, now you say that you can do like 2 years worth of dentistry or 1 year worth of dentistry in one visit. The busy people, woman has 3 children, a person's busy, they're running a business, or they have 2 or 3 jobs. How does sedation help them?
Well, as we mentioned earlier in the program, the typical dental process, if you need a variety of different treatments, you're going to be sent all over town. And you have to coordinate those schedules. You have to take time from work. You have to take time from family to go to all of these appointments. If you can have everything done at one time in a safe manner, and you can have it done while you're asleep, that's even better. And so for certain people that have extremely busy schedules, whether it be the housewife that is trying to wrangle schedules of 4 different school-age children, which is extremely difficult. I know my wife just with our children, that's a total job in itself. Whether you are a salesperson and you have an extremely busy schedule, whether you are a manager, a CEO, a variety of different, everybody's busy. There's nobody that's not busy. If you can make things more efficient, more convenient, who isn't going to like that?
So the concept is, I guess you could only hold your mouth open in a dental office for so long, maybe an hour or so.
Well, you don't even
this allows you with sedation, they could be there for 4 hours and not even know it.
Exactly. We get that question a lot. We say, how am I going to have my mouth open to do the work that you need to do? You don't even have to. We have equipment that does that for you. So you are nice and relaxed and sedated with the sedation procedure, and we have instruments that we use, and it does the work for you. So you don't have to hold your mouth open at all.
Okay.
And we can take care of everything that needs to be taken care of.
Now, I told you said you have like thousands of photos, right? Pictures of before and after photos. And I said, bring photos of people that if it weren't for sedation, maybe they wouldn't have done the procedure. So let's take a look at some of the photos. So sedation got them there.
So this particular patient, he had a significant amount of dental work done in another office. And this other office used pill sedation. And he said even with the pill sedation, he still remembered according to his words, every excruciating detail of his visit. And he said after that, he was so terrified and afraid that he would never go back. And he had a bunch of half-finished work in his mouth, and he just would not go back because he was afraid. And he is told before that procedure, no, you're going to be asleep, you're going to be sedated.
But it was a pill.
But it was a pill.
Okay.
And so he had avoided going back. And when he saw that we offered IV sedation and read our experience in the type of work we do and that we can complete everything under one roof, he came in and he was still very apprehensive. And once we did his procedure and he was asleep, he said, this was great. I didn't remember anything. He said, the hardest part was driving to the office. He says, once I was able to do that, I came. He was able to have everything finished. And you can see he had a significant amount of work done. And you can see
it looks great.
He's a happy guy.
You couldn't even see his teeth on the before.
Well, no, because it was half finished. They weren't done. He just wasn't going to go back to have it finished because he was scared. And
so statistically, like 95% of all dentists don't do IV sedation. Is that right?
No,
about that?
Because you certainly don't receive training for IV sedation or most sedation procedures, period, in dental school. And even in postgraduate training, a lot of the programs, you're still not getting IV sedation training. You might get oral sedation training with the pills. So there are only certain specialties that regularly train the dentist on how to do IV sedation. So yes, the number of people that do that are not very high, especially for more advanced, complex work.
So safety-wise, if it was a family member of yours that needed a big procedure, you wouldn't just go pill alone. You would say IV sedation.
Oh yes, and most of my family members have had IV sedation procedures done. My mother, my daughters.
Is that right?
Yes, I mean, for example, one of the doctors I work with in our office, he's taken out all the wisdom teeth on all of my daughters, and of course they were all IV sedated, and I don't think they would have had the procedure done, certainly if they weren't IV sedated, because they wanted to be completely unaware of anything that was going on while the procedure was going on.
Are you charging extra for IV sedation?
For the type of work that we do, because we do more complex procedures that usually are involving more than one thing, for those type of procedures, the sedation is included with the procedures. Now, if it's smaller procedures, then we do typically charge a little bit for IV sedation on some of the smaller procedures. So it depends, but for the more complex type of procedures, it's included with the procedure. So let me show you this other patient.
All right.
So this patient drove all the way from Houston to see us. Now, there's certainly plenty of dentists in Houston that can take care of the work that he needed, but he drove all the way from Houston to come see us because the plan that he received at his office was to, again, get sent to a bunch of different offices all over town, which was not convenient for his schedule, that he was not going to be sedated at some of the offices. At some of the offices they could, some of the offices they couldn't. And that wasn't going to work for him. He wanted everything taken care of now, at one time, so much to the point that he drove all the way to come see us that we could get it done.
Did they hear about you online? They just Google you? Because I know you're all over the internet.
Yes, most patients in those scenarios find us online. Google, we've done a lot of different things, published a lot of different research articles, lecture at countries all over the world, and so we have a pretty good internet presence, and a lot of patients will find us, and what really attracts them to the office in most of the cases are the reviews from other patients. When they can read that somebody else had similar type of work done that they need and that they were able to sleep through the entire procedure, that they had no fear afterwards, that it wasn't as bad as they thought. And that's the most common thing that we hear is, oh, that was nowhere as near as bad as thought I was.
So was he afraid of the dentist or just hated having to go to the dentist?
A little bit of both. I mean, I don't think anybody likes going to the dentist per se.
That's for sure.
But he, convenience was certainly a factor for him.
So he drives several hours to see you.
Yes, but what was important was that everything could be taken care of at one time, and that it was going to work with his schedule.
Okay.
And he wasn't going to have to work around everyone else's schedule. And so that was important for him. So you can see in his before picture, he has a number of issues. When he's smiling, you can't even really see but just the tips of his teeth.
So he has teeth under there.
He
I
has
see.
teeth. You can see
Okay.
a little bit in there, but he's hiding a lot of them. So he comes in and we review his medical history, make sure that everything that we want to do is going to be safe. We consult with his physician, get clearance for what we need to do. And then on the day of his procedure, we start the IV. We have him nice and relaxed and sedated in a matter of seconds. And when he wakes up, all of the hard work is done.
Nice.
And on a single day, we're able to give him a smile that he's happy with. It works with his schedule, it worked with his fear level, and he's happy. And he comes back and sees us now for his follow-up visits, his maintenance visits, and he knows he doesn't have to be scared to come see us. And he comes in and he's a happy guy. You can see
Is
it in
this
his
one of
smile.
those things where they say, I should have done this years ago? If I'd have known about sedation years ago, I would have done it.
Yes, we hear that comment quite a bit, that if I knew it was going to be like this, I would have taken care of this years ago and I would have never got to the state that I was in. So one more patient I'd like to show you.
All right.
So this patient, very common scenario that we see in the office. One, did not like going to the dentist. Pretty universal. Most people don't like coming to the dentist. I say, no offense
Do you
taken.
have a one-liner after all these years? Like, Doc, I can't stand dentists. I mean, what do you say?
I say, I don't like most dentists either.
All right, all right.
But most patients, don't like coming to the dentist. They've put off going to the dentist. Another reason they put off going to the dentist is they've taken care of everyone else and they haven't taken care of themselves. And because they have avoided the dentist because they were putting everyone else's needs first, they are a little afraid to come back because they haven't had anything done for a long time. And so he had a number of issues. He had gum disease, cavities, missing teeth, you name it. He had those problems. So with his treatment that was being proposed by his dentist, they wanted him to see a number of different doctors around town. A lot of them wouldn't sedate him. So he comes to see us, and again, same scenario. We are able to do everything in one visit. We're able to relieve his anxiety, relieve his fears, take care of everything by giving him a simple IV. We're able to manage things more effectively, safely, and he gets it all done.
He looks good.
And you look at the difference between them. You can see he has a significant amount of work done, no more gum disease, no more problems that he's having to treat, and he's happy. And it was all done in one visit with sedation.
It's totally changed his appearance.
Oh, completely. You can see he looks more confident. He looks happier. He looks more approachable. He looks like a different person.
So this might have been staged over 9 months with that 3 dental model where you send him out all over the place. And since you do it all right there.
Well, his treatment plan probably would have taken a year and a half.
Is that right?
Yeah, it would have.
You do it, I mean, is it just lip service you're saying one day? I mean, you got that initial consultation, but like literally in 2 or 3 visits, it's done.
Yeah,
Is that right?
So again, you're always going to have a consultation visit because one, we need to make sure that we know your history, make sure that we can treat you safely. So we need to review your medical history. But in terms of treatment time, very frequently in most situations we can take care of everything in one visit because when we have somebody sedated, it makes it safer. We can control blood pressure better. We can control your oxygen levels better. Because if you're nervous, your heart rate's going to go up. Your blood pressure is going to go up. You're going to be breathing much more rapidly. You are going to burn through your blood sugar a lot faster. You're not going to be able to stay in the chair that long. So one nice thing when we have patients that have been through this process and they see that things aren't as bad as they thought they were going to be, that it's actually fairly pleasant. They can receive sedation and have everything taken care of. They tell their friends. And
It's like the only way to go, they tell their friends. You got to do sedation.
I'll tell you one example. We did one particular person, and that one particular person, I think we've had 10 of his friends that have come by who were all similar situation. They were afraid of the dentist, and when they saw that he went to the dentist, and I think his teeth were probably the worst, and he had the courage to come in and see us and got everything taken care of, and he says, hey, it really was pretty easy. I got the IV, I was asleep, and everything got taken care of. Now, 10 of his friends, and I'm not exaggerating, 10 of his friends have come now to get this done. And because they had it done, they tell their friends. And
they must look funny when they're out. 10 guys hanging out together, all dazzling smiles.
Wait, yes. Yes,
Like, who are those guys? Oh, they went to go see Dr. Holtzclaw.
Yeah, they're the crew.
Yeah. So we really are out of time. And I know you got a lot of you have a stack of photos left. So final message to somebody, they're either a dental phobic, maybe they've been in 10, 15, 20 years, or they're just busy. They're saying, I'm too busy to go to the dentist. What do you say to them?
I say to them that sedation dentistry is extremely safe. It is extremely effective. We will hear that from patients sometimes. They say, well, I can't be put to sleep. You know, I always have problems. And there's the medication will do its job. I've had patients where they have had the maximum dose of pills and they're still completely wide awake.
Wow.
And at that point, you can't do anything else because you're at the maximum dosage. Whereas with IV sedation, it's very rare to see that. The medication works much more quickly, much more effectively, because you're going direct to the bloodstream. Any type of procedure that can make you more comfortable, that can make things to where you're going to actually have the treatment done. If something's holding you back, that is going to be helpful and effective for you, because if you're going to avoid going to the dentist because of fear, and there is something that can certainly take care of that fear for you, then certainly why wouldn't you want to do that?
I know you don't want to be negative about other doctors, but I've had dentists on the show that say, Randy, if you have a good bedside manner, you don't need sedation. You could just calm the patient, just numb them up. Do you think that's insensitive? They don't get it, possibly? How much people are afraid of the dentist? Comment on that,
yes,
please.
I would. I would say that's insensitive to those people, because unless you have actually experienced that fear yourself, you really don't know. Because some patients, something that is scary to them, some people are afraid of heights. Other people can jump out of an airplane. Just because one person doesn't have that fear doesn't mean that that other person's fear isn't real. And when you see some of these people that are, visibly shaking just because they're in your office, they're not faking that. That's a true fear. And when we can alleviate that fear with an IV and some medication, that does a world of wonders for those patients.
So now there's no more excuses to not have the smile you've always wanted.
There really isn't.
I mean, fear is not one of them for sure. Time's not one of them anymore.
Yes, we can certainly eliminate all of those barriers.
Okay, good. I want to thank you for coming to the show. Good stuff.
Oh, well, thank you.
And always a pleasure. Always a pleasure.
Yes.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.